Hi, this is Hear the Rod podcast. I'm Paul Schneider. As always, the podcast is available on Apple, Spotify, Amazon, Google, and most other podcast platforms. And as always, you can follow us on here.the.raw, and that is on TikTok, on Instagram. Sorry, that's here.the.raw on Instagram, and here_the_raw on TikTok. You can also follow my latest campaign, which is hashtag Paul's Journey. So, as you may know already, unfortunately, I've got secondary cancer from my diagnosis 3 years ago, and I'm documenting and blogging that journey under the hashtag Paul's Journey on Instagram and TikTok. So, today's podcast is a fascinating one, and one I've wanted to cover for quite a while. When I was diagnosed 3 years ago, I was introduced to the Swallows Head and Neck Cancer Charity by Mount Vernon Hospital, actually. And the reason I was introduced to them was because I asked so many questions during my qualifying call before my treatment started. I had so many questions for them that they actually steered me towards the Swallows Head and Neck Cancer Charity to give me help on what I needed to know. So, note to self, when anyone's listening to this, keep asking questions because it gets you more help. But on the back of the relationship with the Swallows Head and Neck Cancer Charity, I was introduced to a company called Thor. I've got today with me a guy called Paul Burns. Paul is European Oncology and Late Effects Manager at Thor, and Thor gave me access to some photobiomodulation kit. That's PBM. That's quite hard for me to say, by the way, with my facial paralysis, but I've given it a let's go. That's PBM, photobiomodulation kit, which is amazing at helping with the side effects and late effects of radiotherapy. I could speak from my own experience on that. And I've got Paul here to talk about it a lot more. So, hi, Paul.
Hi, Paul. How are you, mate?
I'm doing okay, thank you. Thanks for joining.
It is my
Um,
pleasure.
Really good to see you. So, I hope I did a good introduction there about Thor. So, obviously, Thor are based in Amersham. Do look them up. Paul, what's the website if anyone wants to look up Thor?
The website is, do you know, I'm just going to double check whether which website, because I obviously just click on my favorites every single time, whether we're Thor Laser or Thor Medical. Thor Laser. So THOR Laser, LASER.com, thorlaser.com.
So if you want to know more after this podcast, do look up thorlaser.com. So Paul, let's start with I've spouted out here that you've got some kit that deals in photobiomodulation, PBM treatment, if that's the right phrase for it. I think to most people they'll be going, right, I think I'm about to switch off here and unless somebody gives me a good explanation. So talk us through photobiomodulation. What is it? How does it work, Paul?
So PBM is, put simply, it's the application of light to tissue in order to generate restorative effects. Now, the application of light to tissue and how it can have any kind of influence is sort of an odd concept to some degree. But I always put people in mind of, we've all, listening to this, been affected by the sun. We've either been tanned or we've been burned by the sun. Now, it's a different type of light to the light that PBM delivers, but it's the same principle. It's light changing human cells. And PBM has been in use inside the NHS for decades without anyone sort of really realizing it. So there's two examples. The one I always like to bring up with people is that when babies are born prematurely, they're placed into incubators underneath a blue light to prevent
Yes.
jaundice. And that is PBM. That's photobiomodulation. That's the application of light to tissue to generate a response in those cells. So PBM is light being applied to tissue and has actually been in use in the NHS for decades.
And to be clear, I thought it was infrared light. Is it
So
infrared or is it ultraviolet then? What is it?
yeah, so the light that Thor deliver is we deliver 2 points, two monochromatic points of light, two singular points of light. There is red light that you can see that we
Yeah,
deliver, and there's also near infrared. For the purpose of this conversation, I'll say infrared,
yeah.
which we can't see. So we deliver those 2 points of light. When you deliver PBM, you can choose effectively which part of the light spectrum you want to deliver. So, for example, purple light tends to be applied in dermatology for things like eczema and psoriasis. I mentioned blue light for babies who are
Yes.
jaundiced. When it comes to the cancer treatment side effects, all the evidence and the data shows us that it's this red light and the near infrared light, which is most effective in terms of what we're trying to tackle.
Okay. And you said that I hope I quote this correctly. You just said it changes the cells, right? So okay, I've got some. So okay, let's talk about my experience from a few years ago then.
Yeah.
So I had head and neck. I had parotid cancer. I had major surgery. Oh, that's my doorbell. I'll turn that off now. I had major surgery on the left-hand side of my head and neck to remove the saliva gland, and the radiotherapy treatment was ultimately done the left-hand side of my head, face, and neck, where the now let's get this right. The radiation treatment itself was mutating the
Yeah.
cells in my head and neck by the sheer nature of the treatment, right?
Yeah.
Are you so take it from there then. What does your light do from there? So the radiotherapy light is or the radiation light is or beams, sorry, is mutating the cells in my neck. I
Yeah.
would then come to your office actually in Cheshire at the time, which is now Amersham. Let's be clear, it's Amersham now. What would the PBM treatment be doing? Would it be reversing that?
No. So in terms of how PBM changes cells, it doesn't mutate cells in the way that a cancerous development does. It doesn't alter the DNA of a cell. What PBM does is it reduces what we call oxidative stress and increases what we call ATP, which is cellular energy. The biology
Okay.
behind this is extremely complicated, but to put it in really simple terms, PBM has a profound anti-inflammatory effect. So
Right.
what PBM does is, when it comes to cancer treatment side effects, it makes the cells that would otherwise be collateral damage, it makes them significantly more robust. So
Right.
what happened was the background here is that in 2018, NICE, the National Institute for Health and Care Excellence, they looked at what evidence existed for the use of PBM in the prevention of oral mucositis, which is a treatment side effect that I think a lot of your listeners, a lot of your head and neck listeners will be familiar with if they're either
Mhm.
going through treatment or have been through treatment. It is essentially ulceration of the oral mucosa. So,
Yeah.
like if ever you've bitten your lip when you're eating any food, you get that mouth ulcer. It's like having that inside the whole of your mouth. It's extremely painful. It affects ability to eat and drink and swallow. And
Yes.
so it affects nutrition, it affects sleep. It has a huge effect on quality of life. And what
It does, and it also creates a lot of internal mucus, which is quite nasty. Yeah. So speaking from experience, yeah. Sorry, Paul, carry
Yeah.
on.
No, no, well, your experience, your words are more important than mine, Paul. On that, you've walked this walk. Do you know what I mean?
Yeah.
And I mean, I've been working, you mentioned the swallows earlier. I've been an advocate of the swallows for 14 years now. So I've been working with head and neck cancer patients for 14 years. And so obviously I've seen this firsthand and I've seen the suffering that it can cause. And NICE looked at all the evidence and in 2018 said, we recommend photobiomodulation, PBM, as a effective and safe intervention in order to try and prevent and treat this particular side effect. So what's happening is that reduction in oxidative stress is helping prep the cells for what's about to come effectively. And
Right.
the evidence as demonstrated by NICE is that we really can make some pretty significant differences to the cancer patient journey whilst they're on treatment. What's kind of happened since is we're learning much more about what PBM is doing for patients after treatment as well, which has become really, really exciting. But yeah, in principle, it really is very straightforward because you are just applying light onto tissue
Mm.
and that just biologically, so there's no medical intervention, there's no drug here or anything like that. It isn't
No.
but biologically, the cell responds to the light in the same way, we respond to absorbing sunlight.
Yes, and so I think it's important to mention here that when I got access to or connected with Thor and you guys, thankfully I lived quite close or do live quite close to your offices, and actually was able to go to your offices to self-treat actually. Now, what would happen? I think it's to give some credence to all of this, and the reason why it's so important people hear this podcast and how good PVM is because I've got a personal experience using the kit and saw personal gain and benefit from using the kit. Now, to put that into a very short story, very short, I I got introduced to Thor approaching the 4 week mark into my 6 weeks of treatment. And the internal side effects, Paul, of my treatment was really kicking in. My voice was obviously almost gone. The mucositis was stepping up, I would say, significantly. The soreness and the pain was creeping up on a daily basis, and I still had 2 weeks to go. So I was at a really worrying stage, right? I was, how bad is this going to get? And you don't really want to be thinking that when you're going through radiotherapy. You just want to get to the end and not having to worry about 2 weeks still to go. So I went for an initial consultation, which showed me how to use the kit and actually to see if I was, um, I guess, fit to use it, which I don't see why anyone wouldn't be, but that's important, I guess, an initial consultation. And then I started using the kit and I saw immediate gain. Now, what I think, if I remember rightly, what I think I did, Paul, you probably remember this yourself.
I
I
do.
would go for treatment every day, Monday to Friday, and I would head over to your offices afterwards and use the kit every day in on all the sore points on my head and neck. And what I felt was well, put it this way. The reason why I knew it made a difference, and I think this is the key thing this is the key stat of my experience to justify the gain, was that you don't have radiotherapy on a weekend. But I still came on a Saturday and a Sunday to use the kit. And what I therefore got was 2 days of non-radiation treatment, but 2 days of PBM supporting treatment. And by Monday, I actually was better than I was on Friday with the side effects that I was facing, which like you're saying before, the treatment prepares your body best for the treatment you're about to go into. I can vouch for that. So that's my story. Go on, Paul.
Yeah, they just so to back up. I mean, I remember that very well, Paul. I remember sitting talking to your dad outside our treatment room while you were in there
Yeah.
treating yourself. And the so first of all, in terms of delivering the PBM, it's delivered via two handheld probes. I know here at the office you also had access to the bed, didn't you? The access to
Yes.
the
Yes.
remote control bed. Mostly when we're targeting the mouth area, the head and neck area, we use a couple of handheld probes, and treatment only takes somewhere between 5 and 10 minutes, depending on how many treatment points there are. And it is something that can be done by an individual. It's not something that needs to be delivered by a clinician, or
Yes.
a person. You're literally just holding onto these handheld probes. We would always like it delivered under supervision of a clinician, and this sort of is going to come on to the work we're doing with the NHS to try and get as much access to this as possible for people.
Yes.
But yeah, by and large, the actual delivery of it is extremely straightforward. And
Yeah.
the reason why NICE recommended it is because they looked at the weight of clinical evidence, and the weight of clinical evidence, and this is not just, when you and I talk directly, Paul, about your experience, speaking from a clinical evidence point of view, you're a case study. You're an individual
Yes.
study. And it's great that it worked for you, but that in clinical data terms doesn't really prove all that much.
Right.
NICE had at the time, I think it was 42 randomized controlled trials they were able to look at and say, well, goodness me, this really can have a significant impact for people. There's always a slight expectation management because, of course, there's lots of other factors that will, depend upon how you're going to respond to treatment. So things like smoking,
Right.
drinking, things like this. It's the usual story of the better you look after yourself, the better these things are going to be. And the
Yes.
clinical suggests that we'll see a significant reduction in mucositis in around 80% of people undergoing their radiotherapy for their head and neck. So, which obviously is a huge, significant number.
Yes.
There's always that sort of slight expectation management you have to do because we're living in a medical world, and sometimes things don't always go as to plan as we would like them. But obviously, your story is very much echoed in the clinical evidence. That's the point I want to make.
Yeah, it's no, I'm pleased, and it's I have to say that I always wonder about placebo, Paul. I think we've spoken about this before, and
Mm.
placebo is a thing; it is
Yeah.
real. However, the situation for me when I went into to use your kit, which is extremely easy to use and self treat. We'll come on to that in a second, in a bit more detail. It is I didn't have any placebo. if I'm honest. And I'm a big placebo adopter, if you like. I just came in and thought, well, all right, then I'm just going to take whatever's thrown at me. They say it's good, I'm going to give it a go. That isn't placebo as far as I'm concerned. So placebo didn't even play a part. But I genuinely felt physically the benefits. The most amazing one I remember now. I don't know how much you have to do with the sunbed version of the treatment kit that you have. I know that it's the smaller kit that you're mainly trying to get into hospitals, etc. And we're going to come on to that in the next chat. But the most amazing difference I ever felt was, and if anybody can get access to your beds, so I suffered with fatigue
Yeah.
chronically. I think chronically is an understatement. I remember getting out the car, dragging myself, literally dragging myself into your offices to get into the treatment room, and I had energy. I mean, I was asleep in the car pretty much because I couldn't keep my eyes open. I dragged myself into your offices. I couldn't even hardly talk when I got in. And I think at that point you mentioned the sunbed, as I call it, the sunbed version. Sorry, I know it's not a sunbed, and I think
No,
it's really important to say it's not.
hey, to all intents and purposes, does it look like a sunbed? Yes, it does.
It does, yeah, but it's actually yeah. But let's be clear, this is a cancer podcast. It is not a sunbed. Um, it is a treatment bed. It's a PBM treatment bed. I think that's very. What it does look like, yes, the same as a sunbed, except the lights are red and not ultraviolet. But when I came off of that and I walked out of the room, the difference was unreal. I suddenly was standing there before everybody. It's like Jesus had rearisen, and and it really was, and that is what I saw your kit can do, and that in
Yeah,
itself is amazing.
yeah.
So, so
Yeah, sorry, Paul. Just it's really interesting that you bring that up because we have so I am currently I was recruited by Thor in 2018 because I've been working sorry in 2021 off the back of the 2018 NICE guidance with the idea of, well, hey, look, NICE is suggesting this is something we might want to offer to people. Let's go and talk to the NHS and see if we can't get that happening, kind of thing. And we'll talk in more detail about that. But one of the issues in terms of the bed that the NHS has is literally space, like space to actually fit
yes,
the bed in. Physical space is at a premium inside the National Health Service. As you mentioned my job title off the top. I cover the Europe as well. I cover the continent, and I was in Lille recently, and I met a chap, a clinician in Lille by the name of Antoine Lemaire, and Antoine has a full suite of PBM products. He's literally got 3 rooms, might even be 4 rooms, where there is PBM equipment in each room, and he's got patients coming in to deliver PBM for all sorts, by the way, not just oncology related things as it happens.
wow,
But
wow,
one of the things he has there is the bed is called the Novathor. And one of the
yes,
things he has our Novathor. And the thing he said to me, he said, the thing I swear by this for my cancer patients is fatigue. That's what he
yes.
that's what he uses his Novathor for. He's a clinician dealing with cancer patients, and he gets people who are suffering terribly from fatigue and onto the Novathor they go, and he absolutely swears by it.
And so do I. It was quite incredible. And I think that became a daily used. So in addition to the smaller piece of kit, which is much more pro focus, like you said, it's more. So you've got. Well, let's talk through it. You've got the shower head. You talk through it, Paul. So basically, what I remember is you've got different appliances to apply the light onto ourselves to help reach and cover certain spots that we're suffering with side effects with, right?
Yeah, I mean, you put it as well as I could possibly put it. I mean, bearing in mind we're in an audio format, so we're not in a position where obviously we can show things.
Yes.
What we have is a lollipop probe, which is designed around. It was designed around the shape of a Magnum ice cream. So if you can picture a Magnum ice cream, it's roughly that sort of shape, and the idea is that goes inside the mouth for a couple of minutes, and
Yeah.
then we have the probe that everybody refers to as the shower head probe because it looks like a handheld shower head, and that's
Yeah.
placed externally onto the cheeks and the lips, or maybe across the neck, wherever it is that we're wanting to deliver treatment, because we want to, help the cells that are going to be the collateral damage. And I should say one thing straight away. When we mentioned sort of a lollipop, I get this a lot when I first bring it up and I first show it to people. People sort of respond and say, well, there is a bulk to that kind of thing. And some of our patients are suffering with trismus and what have you. And
Yes.
so we very much encourage use of the PBM from day one of treatment, before the problems have actually manifested. Prevention is better than cure. And clinical evidence really bears out the fact that we expect to see better results when we're using it preventatively than we do when we use it on treatment. We get results on treatment. You are our case study in that. But the clinical evidence is pretty clear that we would expect to see better results when used preventatively. So we very much encourage use from day one of radiotherapy and or chemotherapy.
We've spoken about head and neck because it's quite relevant to me, obviously. But surely it's not only for head and neck cancer patients, the PBM treatment, right?
So this is, it gets into a tricky area in terms of sort of, there's a lot of regulatory things when it comes to medical devices. So we have a CE mark and we have NICE guidance for oral mucositis. That's what the NICE guidance and the CE mark are for. Now, clinicians can do whatever they want with a piece of equipment. Actually, Paul, so can you. People can go onto our website and they can buy our equipment. I mean, they did need to have a a little bit of money in their back pocket. There's no getting away from that. But theoretically, clinicians can do what they want with it, and that has been the case for a long, long time. PBM is very commonly used in lymphedema, for example, which isn't necessarily oncology related. But what we're finding is, as a result of a lot of clinical, we're growing the evidence base, I guess, is how to answer this question. We are growing the evidence base in these late effects areas. That's thanks to, there's one particular clinician we just have to mention, that's Emma Hallam in Nottingham, who has just done amazing things, has looked at what the biological function of PBM is and said, well, let's have a look at what we can do for patients who are struggling years removed from their treatment. So not just oral mucositis, but for radiation fibrosis, trismus, dry mouth. What this means to kind of in a lay terms is where you've got stiff, tight skin that causes pain. You don't have range of movement and things like that. These are all things that are now, PBM is now being used to treat successfully in patients who are removed from treatment. And you asked about different cancers, because again, that's kind of more focused around head and neck. That research is now developing to deal with breast, so sort of certainly breast lymphedema and breast fibrosis. And also kind of the toe is being dipped into developing clinical evidence around gynae cancers as well. So certainly radiation dermatitis is an important thing to point out, because there is an organization called the Multinational Association for Supportive Care in Cancer. That's MASC. And MASC are an international organization who recommend PBM for prevention and treatment of radiation dermatitis. So your burns, your radiotherapy. Burns. So it's very much being looked at in, gynae for that. Well, anywhere on the body for radiation dermatitis, MASC are recommending it. So,
I think it's really important then. So side effects and late effects that the PBM kit is known to help with. Let's just go through this as a list then. Radiation fibrosis.
Yep.
Dermatitis, the radiation dermatitis.
Yep.
Possibly trismus.
Yeah, we've got some really good results on trismus from Nottingham from Emma. Yeah.
Okay. Fatigue, which is more of the Nova Thor sunbed equivalent related treatment benefit.
It is. It's not brilliantly documented evidence-wise. So at the moment, as much as, obviously we hear fantastic things, we have to call it anecdote at the moment.
Okay, well, I've got to be honest, it's my podcast. I'm telling you it works. So it's it absolutely works. I'm telling people, if you got fatigue, use it. Simple as that. So fatigue, trismus, dermatitis, radiation fibrosis, oral mucositis. What else can it help with? Well, that's quite a good list so far.
We're getting, again, this is just anecdote at the moment, and I do want to do more work on this, but we are getting some anecdotal response around dry mouth, xerostomia.
Okay.
Now, that again is not something, I don't want to set false expectations here. Remember, the NICE guidance focuses on the one particular thing. The NICE guidance focuses around the oral mucositis. And also where PBM is effective, it's not just PBM on its own. So often, certainly in the late effects services are offering a suite of therapies, of which PBM is one. Now, adding PBM in has proven to be a bit of a game changer in this area, but it's still not just the PBM on its own. It is as part of a suite of therapies. So this again is where we want to put it, in the hands of clinicians who are able to offer a suite of services to
Yeah.
the patient. And this is why targeting the NHS in terms of delivering this is really important to us, because individuals can gain access to photobiomodulation. It's not always easy because whereabouts it is in the country can be quite patchy. And of course, Paul, unfortunately, not everyone lives just around the corner from our office,
Yeah. Yeah.
and what have you. So in order to be able to get this to people, the NHS is the route. And that's what I've been working really, really hard on doing for the 3 years of my employment with this company.
You have, I've got to tell you, Paul, you've done an amazing job. When I come up, as you and I both, I think, you know a lot of people in the world of cancer. I do too, through my own last few years journey and work I've done. And your name comes up quite a lot, I'll be honest. I keep coming across you all the time. So yeah, look, well done on everything you've done. But on that note, you know, so okay, we've sat here and we've spoken about how amazing PBM is in treating side effects and late effects. And by the way, one thing to quickly drop in there is so the mistake I made is I don't think I didn't continue to use your kit. And I have gone on to suffer with radiation fibrosis in quite a bad way. So just by the way, I'll be speaking to you about this afterwards to get myself back in to carry on using the kit for that because it's quite nasty. So it's something that does need ongoing use. I would suggest for different effects as they develop. Correct?
Yeah, so this is something that Emma, I think you're going to be interviewing Emma, are you? Is the plan?
Um,
Yeah, so it'll be interesting when people listening to this podcast, I'd very much encourage you to listen to Emma, to hear it from the clinician's mouth and hear a clinician's viewpoint on this, because I can try and be as unbiased and as straight up as possible. I am sat here literally as I'm talking to Paul now. I'm sat in Thor's office and I'm wearing a Thor branded, work T-shirt kind of thing. So
yeah.
to actually listen to what clinicians have to say is something I would attach a lot of weight to. And
Yes.
so Emma is very important to listen to in terms of, first of all, where PBM fits as a suite of pardon me, where PBM fits as a suite, as part of a suite of therapies, but also this. Sorry, Paul, you were asking me about me brain went has gone blank there as I'm talking about.
Yeah, that's all right. I was talking about the ongoing use of.
Yeah, sorry, that was it. Emma will also say that she's got a new phrase that she's using in conversation with me, where she's saying to me, PBM is for life. Because fibrosis in particular is a progressive condition,
Yes.
it's not going to heal and go away. So Emma is finding that she can bring people in. She delivers PBM twice a week for 6 weeks, then discharges the patient. She has fantastic results. The patients feel so much better, but it will tighten up again. And they will
Yes.
have to come back in again at some point in order to get that relief. And that's quite a difficult thing to financially negotiate with the NHS, which is you're going to have to bring this thing in that's not going to cure something. It's going to have amazing effects on quality of life and huge improvements for the patient. But we need, the horrible, brutal reality of it is, we need to make really good health economic arguments to the NHS that say, by doing this, you are going to save yourself pounds and pence. It's
Yes.
it's kind of horrible that it has to be thought of in that way, because I wish we could just talk about patient quality of life and for that to be enough. But regrettably, the planet we live on means we have to talk pounds and pence in that regard. But believe me, I am out there having that and doing that, and I wouldn't be able to do any of that if it wasn't for Emma, who really is driving this like you would not believe.
Yeah, so that's an interesting point there, Paul. So survivorship I class it as a lifestyle nobody chooses.
Yeah.
But with survivorship, comes everything we've spoken about and more. Depending on the cancer you've had and depending on the cancer locations, the type of cancer and the location of the cancer will totally determine the side effects you get at the time of treatment, but the late effects that you get after treatment, and that could go on for life. Those late effects don't just kick in after a couple of years and disappear, like you said. Radiation fibrosis, I've got it now. It is progressive. It is debilitating when it happens. Whether it's for a split second or a minute and a half, it is these tightness, bouts of tightness that are quite simply, I wish it was cramping my neck. It's way worse. But the list of side effects is, especially with head and neck cancer, that are not ifs, they're whens. And I think this is really important to mention. the side of radiation and the treatment that they use, the actual radiation treatment they use, it's the same or varying types or different strengths, different lengths of treatment sessions, if you like, for periods of time with different patients, but it's the same, and everybody's body is pretty much the same. Therefore, everybody will get these side effects or late effects at some point in time. And I think it's important to mention ifs, not, sorry, whens, not ifs. And it's really important to, if you are going through head and neck cancer in particular, do look up the side effects that are going to hit you in time. Because when you start to feel this pain or this issue in a certain part of your head or neck, at least you know what it is. And then suddenly you've got something like you've got the PBM kit here, sitting here, that can potentially relieve you or cause or create some benefit to the pain or suffering you've got. How do people get their hands on it now, Paul? This is the
Yeah.
next bit. You've done some great work. Where is it? How can people get it? And what are the less orthodox ways of getting access to it, if you like? Because sometimes that needs to be mentioned too, actually.
Yeah, sure, absolutely. So let's first of all talk about the National Health Service. So yeah, I was brought into this job in March 2021. So I've been having a go at it for just over 3 years now. And the NHS is an incredible thing. It's an incredible institution that is struggling under all sorts of incredible stresses and strains. Anybody who reads the news, watches the news, we've got at the time of recording, we've got a general election coming up, and of course the health service is a key part of that conversation and what have you. So I think most people listening will be aware of the pressures the health service is under. So introducing a new therapy, albeit as simple as we've described here, is not a straightforward thing, because, well, just to take a really simple sort of thing, I mean, it needs to be cleaned in between use. Who's going to do that? Who's going to monitor the cleaning of it? What have you? That presents itself a little challenge that the NHS has to sort of look at. Now, I'll just sidestep slightly to say that the pounds and pence argument for on treatment patients is, we think, pretty easy to make, because we've been able to show, we've got data from inside the NHS that shows by using the PBM and reducing these side effects, we can reduce the amount of money that's spent on pain relief, the amount of money spent on analgesics.
Right. And that's medication and services for, yeah?
Exactly, yeah. And which means you're also reducing, by the way, the side effects from analgesia as well. So you're reducing the management of analgesia side effects. You're also reducing unplanned readmissions into hospital. Patients who are undergoing treatment will occasionally need to be readmitted because they're struggling to nourish themselves, because they can't eat and drink and what have you. So for as long as they can continue to eat and drink, and for as long as they're in less pain, patient feels better, health service spends less money. So in terms from the on-treatment point of view, the pounds pence argument is, we think, fairly easy to make. And I'm pleased to say that as difficult as it is working with a health service that's under such incredible strain, the PBM kit is now being rolled out across the NHS, slowly but surely. I'm not going to list all the trusts here that are using or aren't using. What I don't want to do on this podcast is kind of embarrass sort of anyone. But what I will say is, it is happening across the country, but I have to tell people listening that at the moment we are a little bit at postcode lottery stage, where depending on where you're diagnosed with a head and neck cancer, because we are specifically, remember, talking about the NICE related, for all these other things, it's my job to be responsible and point out that the NICE guidance is primarily focused on the oral mucositis. You can say whatever you want, Paul, and Emma, when you listen to Emma, she can say whatever she wants.
Yes.
I have to try and be sort of sensible about how I approach this. I'm sure you understand where I'm coming from.
I do, of course.
Yeah, of course. So I promise, and Paul, you said really nice things there. I promise everybody listening to this, I am working like you would not believe to make sure that you, the patient, has access to this therapy. I am working incredibly hard to make it happen.
Just to cut in there, Paul, and I don't want to mean to embarrass you in case it's not there, but how does anybody check if they're in the right postcode? I think you may say, I don't want you to say, well, what's the answer really?
So I'm very, very happy for people to contact me via Hear the Raw. So you've got your contact details there. So if people want to get in touch with Paul Schneider, and Paul will pass it on to me, Paul Burns, and I will. So the first thing I'll do is, if there's an NHS trust in your area that, I mean, if it's available for on treatment, great, I'll let you know, and you'll be going in for your treatment and you'll be able to get it. The late effects is trickier because one of the reasons why it's going to be really important for you to speak to Emma is we really need more late effects services in this country.
Yes, we do.
These late effect services, what Emma does, and I'm gonna sound so biased when I talk about Emma. I'm not saying anything on this podcast that I don't say to Emma herself. She provides an unbelievable service. It's absolutely unbelievable, the difference. I could tell you, and I'm not going to steal Emma's thunder by giving you some of the patient feedback that she's had over the years we've been working together, but it's absolutely phenomenal. From the words of patients, the things they have told her about the difference she has made to their lives, of which PBM is a small part. So at the moment, the late effect services they're not the easiest to access. So when we come to unorthodox, Paul, to your earlier question, what I will always look for private providers who have previously purchased equipment from Thor to see if there is something in your local area where you can go and gain access to the photobiomodulation. But I've got to tell everyone listening that one of the most important things patients can do, and I regularly liaise with a number of patients because I've been working with the Swallows for 14 years. So I speak to patients, and yourself, Paul, obviously, me and you have known each other for 3 years now.
Yeah.
So I regularly liaise with patients, and the power of your voice on this issue, on this and many issues, is absolutely critical. If everyone who can benefit from this is going to get it, the people who need to shout loudest are the patients, because the patient voice is the one that the National Health Service has to listen to, ultimately.
Yes.
Have to listen to the person sat here in the Thor sweatshirt, okay? It doesn't have to listen necessarily to its own clinicians, because it's difficult. It's a difficult service. You know, sometimes people don't have time to listen and have the conversation. It's tough. It's under an awful lot of strain. When the patients start to talk and noise gets made in patient groups, when I've got people who have emailed their local MPs and said to their local MP, why was I not offered this when I'm on treatment? Why can't I get it now that I'm out of treatment? Whereas someone in Nottingham can.
Yes.
Why can't I get it? And they can. So your own voice is really important to this and getting it to people who need it. And just to finish on that, I want to be really clear, and I want to try and be sort of really, really responsible in saying to people, I want to get across, PBM isn't a miracle, because if there was such a thing as a miracle, then I'd be an incredibly rich man if there was such a thing as a miracle. And Paul, you'd be sat here now with no fibrosis and everything would be absolutely flipping perfect. Do you know what I mean? There is work to do in this area, because for the NHS to adopt in certain areas, it's going to want more clinical evidence, which we're working to get. You know, Emma is working to get. She's working so hard to do it. So there are things that we need to do at our end as well, you know, that we are doing to make sure that this is something that we can really, really and truly convince everybody who needs convincing that this is something that can be really important for people.
So do you and I need to talk about a campaign, really? A joint campaign?
Yeah, what I'm going to do, so again, it's a tricky one for me, Paul, because I find myself caught between two sort of stools, in that I am employed by this company. And there are other PBM companies out there. You know, PBM can be provided by people other than Thor, and it is for you know, for people to make choices around. I mean, I could sit here and do the full Thor spiel, you know, and sell why we think we've got the best equipment, etc., etc. I could sit here and do that. I'm not going to embarrass anyone by doing any of that or taking up anyone's time. The point is, PBM as a therapy works. Okay.
Yes.
And what I don't want to do is encourage people into falling into the trap of going online, finding something that delivers red light in a handheld device and spending your own money on that, because it's not going to work for various reasons. You know, that's something I need to tell people not to be sort of fooled into. Don't part with your money but by doing something like that. This really needs to be delivered ideally under the auspices of healthcare professionals who can
Mhm.
be helping through your journey, and this is a part of your journey. That
Yeah.
idea is how this would be sensibly delivered, and that's what we're really working hard to make happen.
I agree, and the work that the later effects clinics are doing all over the UK, they are few and far between, and you're right, more of them is required. So let's cover off here again. So PBM, the Thor kit, the PBM kit from Thor, helps with initial side effects like oral mucositis whilst going through treatment, and that can also occur into the recovery stage of going through treatment as well. So after the actual treatment itself, that can continue. But the Thor PBM photobiomodulation kit can also help with late effects. Now, side effects and late effects, again, very different things.
Yes.
Side effects are what I would call, immediate effects of treatment going on at the time of treatment and pretty much for the next 6 months after. Anything after that, as far as I'm concerned, is late effects. And there will be, and there are many. So this goes out to all head and neck cancer listeners. Anyone just generally, I can say this, I know you can't, Paul. Anyone suffering with any side effects or late effects of radiation or chemo, I'm going to say it, should be looking at PVM and should be looking at Thor for how their kit can relieve them or certainly ease their journeys both now and going forward. So the website again, Paul, thorlaser.com.
So we're thorlaser.com. I'd be lying if I said our website is the best website in the world. But it will give you it will certainly give you more of an insight into this. And look, I am always prepared personally to see what I can do to try and help individuals. My Thor pay my wage. Thor's my day job, but I've been working as a patron of a charity in this area for 14 years. My passion for this extends long beyond receiving my payslip at the end of a month. Do you know what I mean? So I'm always going to work. It's just that thing of trying to set people's expectations. I would love to be able to every single person listening to this say, yep, you need to go to that address on this day, and that's where you'll get your PBM. Regrettably, that's not where we are yet. But with your help, we'll get there. We'll get there for you, the people listening, and we'll get there for people who are yet to go on this journey.
Yeah. So you can reach me at on Instagram and TikTok if you want to make any inquiries about PVM, which I will liaise with Paul as a result of directly afterwards. So Paul, I've got to say thank you very, very much. You've done some amazing work in your area of the industry. You really have, Paul. I've got to commend you for that.
Well, right back at you, Paul. I mean, like I mentioned, the patient voice. Here you are, the patient voice, making sure people can hear you. That phenomenal. Thank you.
No, you're welcome. So let's keep doing what we do, eh? So that was Paul Burns, European Oncology and Late Effects Manager at Thor. Again, Paul, thanks very much. You can find Hear the Raw podcast. So this is Hear the Raw podcast. I am Paul Schneider. This is always available on Google, Apple, Spotify, and Amazon, and most other podcast platforms, and on TikTok and here_the_raw, and on Instagram at here.the.raw. Paul, thank you, and I'll speak to you. All the best.
Bye bye.
Cheers.